Hey, hi, my name is Lauren, and this is my chest tube teaching video. I have Bob here, and he's a mechanic, and he was under a car lift, and the car lift gave out, and a car fell down and crushed his chest. He's having trouble breathing, and imaging studies have shown that he has fluid accumulating in his pleural space. So I'm going to do a little teaching about a chest tube for Bob. Bob, I know you told me you can't breathe very well. You're going to get a chest tube put in today, and that chest tube is going to help drain the fluid out of your pleural space, which your lungs are in, so you can breathe a little better. When you go in there, the doctor is going to make an incision and insert a chest tube about nipple line. And he's going to suture that tube in place to make sure it don't come out. And then there's also going to be an airtight dressing put over it. After you come back, I'm going to take a set of vitals, assess how you're breathing, and just assess overall how you're doing. It's important when you have this chest tube that you don't get up without calling for help. Press your call light, because that tube can fall out. Okay, we don't want that to happen. This chest tube is also going to be kept on the floor below your bed to assist. Just so by gravity, all the fluid is coming out more effectively. I'm also going to be listening to your chest, and I'm going to be assessing your dressing as well, just to check on it. In the beginning, no, I apologize. It is not normal if you're feeling the skin around the chest tube, and if you have, if it feels like it's like crackling or popping, it's called crepitus. It's not normal to feel that. So if you feel that, please let me know, or I will look for that as well. Okay, so I'll go ahead and show you what your chest tube system is going to look like. So this right here is your collection chamber, and this is just the fluid that's going to accumulate out of your pleural space. It will fill up gradually, and me or some other people might come in here, and we might have to mark it at a certain time, and we'll mark it, we'll date and time it, just to see what kind of drainage we're having in a set amount of time. Right here is your suction chamber, and we can apply suction so that the system can it pulls the fluid and air. It applies negative pressure to pull the fluid and air out of your lungs, out of your pleural space a little better. And then this right here is your water seal chamber. It is normal if you see the water in here. This little chamber right here is going to have water in it up until about 2 centimeters. It's normal to see the water in here go back and forth. That's normal. It's called tidling. It does it with each breath you take, each exhale you take, each inhale and exhale. In the beginning, it's normal for there to be bubbles, bubbles in the water. Later on, if there's some bubbles, if you see them, we'll look for it. But bubbles are not normal because it could be an air leak. If this fills up by any chance, nobody should ever pour this out or anything like that, empty it. We have to get a whole new system, and we have to throw it away. It has to be thrown away in a red biohazard bag, and we have to attach a whole new system. Once your lungs start to re-expand and we notice you're starting to breathe a little better, and the imaging studies show that there's less fluid accumulation in the pleural space, the doctor can go ahead and remove the chest tube. It's normally it takes about 2 to 3 days for the chest tube before we pull the chest tube, but each patient is different. And then once it's removed, we'll assess how you're breathing, vitals, and just overall how you're doing. One point I did forget to mention was that while you have this chest tube in, it's important that you cough and you deep breathe, and I can help you out with that. And so.